Thanks, Treasurer. I can see the ice cream stampedes already. So the vaccination blitz has gotten off to a great start. We've seen a great response this morning and all through yesterday. There have been more than 36,000 bookings made over the 4 days. We did see an initial spike in online bookings, up 90% in the 24 hours on Tuesday and up another 13% from Wednesday to Thursday. In the first 3 weeks of the year, 851,147 adults have had their third dose and 10,919 Victorians 18 and above have received their first dose. That's a big achievement for a lot of people. It's a reminder that vaccinations are still available for everyone. You can still make bookings for first, second, third doses, kids' doses. And even if you're just starting, we're here to support you to get vaccinated. You will not be judged if you've not been vaccinated up until now. You will not be judged if you're coming with some reluctance or having had a different view about vaccination in the past. We will be delighted to see you. We'll be delighted to support you in getting vaccinated. And the teams here in Sandown and across the state are unanimous in being enthusiastic about being able to vaccinate people to protect everyone. There have been more than 130,000 5 to 11-year-olds who've so far received their first dose. That's more than 1 in 4 children already who've now had it. It'll climb to 1 in 3 very soon, perhaps even by next week. So in just 10 short days, that's nothing short of incredible. And really it's getting up to the levels that the United States are in for childhood vaccines 5 to 11, despite the fact they were one of the first jurisdictions in the world to start their kids' vaccine program. Australians, Victorians are absolutely fantastic in their enthusiasm and their understanding of what vaccines mean in protecting everyone. The same for boosters. We're now at booster levels that the US has, despite, again, having a relatively late vaccination program compared to them. But we're still seeing pressures. We know that there are still extreme pressures on our hospital system and will be for a few weeks yet. We're starting to see in our own hospitals the benefit of third doses in protecting against serious illness, and similar patterns seen overseas. Simply that a second dose of COVID vaccine may not be enough to keep you free of serious illness. Yes, it's protective, but that third dose we now understand to be even more significantly protective against ICU dying, hospitalisation. As of Tuesday, more than 97% of people in our ICU wards had not had their third dose. But another way of looking at that is people who've had a third dose make up 2.6% of COVID positive patients in ICU, but as of today they make up 20% of Victorian adults. Many didn't have a third dose because they simply had only just become eligible or weren't yet eligible. It goes to show, these ICU figures go to show just how much a third dose can mean in that additional protection. Unvaccinated Victorians do make up a considerable proportion of COVID-19 people in hospital. Again, despite being, if you look at over 70s, less than 1% of people are unvaccinated, and yet looking at the hospital population, a significant number, much more than 1% make up hospitalised patients. So book that third dose or come to a walk-up during the vaccination blitz sites. I've had my third dose, you've heard the Treasurer's had his, or visit GPs or pharmacists over this coming blitz period and beyond. And in the meantime, we should continue to do those simple things that protect us and our community. Keep getting tested. RAT tests increasingly available. We're delivering 50,000 per day. How many of those are used and getting tested, we're not sure, but the consumption of 50,000 a day suggests that there are probably around that number getting tested every day with RAT tests. So that's a terrific number to add to our PCR testing system that's doing another 40, 50,000 every day. Meet outdoors if you can. If you're meeting indoors, ventilate it to the fullest extent that you can. Open external and internal doors, open windows. Wear a mask and stay safe. Thank you.
So, if you've got any questions?
As the Chief Officer, do you expect to give advice to Minister Foley or Minister Molino in the acting presence to mandate jab for the entire public service and or the construction sector?
Look, the request hasn't come to me yet. Very happy, of course, to provide advice on that should that request come through. The benefits of the third dose are very clear, but as the Treasurer said, there's a lot about our personal sense of responsibility that's going to get us a long way there. So the question of a mandate isn't a settled one necessarily, but very happy to obviously assess that and provide advice if requested.
Just over 1 million Victorians are eligible to get the booster shot but haven't done it yet. Is there, from what you're saying, hesitancy, or people are just waiting for holidays to be over? What's the hold up with that group?
Yeah, I don't think there's a great deal of hesitancy. I think we can always do more to provide that clarity of understanding about what the benefit is. Clearly, we had a lot of protection from 2 doses with all our previous waves, including Delta. Omicron changed the game a little bit. It got around that second dose protection, both in terms of the severity of illness that it could cause in vaccinated individuals, and it swept through. Many of us have become infected with Omicron in the last few weeks, and all of us know someone, I would hasten to add, that are either isolating because they've been cases or quarantining. So I think people understand that a booster dose is that additional protection that we really need now, especially with Omicron, but we can do more to get that message out. I don't think people are opposed to the idea of boosters. Maybe they don't feel that sense of urgency, but we know what it means for our health system to have that additional protection, and we know what it means for individuals to have that booster dose, that third dose.
Do you think people are waiting because they've had COVID, but they're now perhaps wanting to wait 3 to 6 months? Is that...
I think there are some. I mean, we've provided advice, and it's been clarified recently that as long as you're recovered from acute illness, you really can get that third dose. ATAGI, I think, will give more formal advice in coming days about whether you should get it as soon as you've recovered or whether it should be at 1 month or 2 months. It might be that you prime the immune system more if you wait just that little bit longer. You don't have to wait 6 months after infection. You don't have to wait 3 months, in my view. So I think you can get it when you're recovered, but ATAGI might give some formal advice on exactly the best timing for it.
Just to follow on,
just on that.
Sorry,
sorry, Professor Sutton. Just to follow on from that question, do you think there's been a sense of apathy that's emerged in the Victorian community about getting third doses, maybe because people don't believe Omicron is as serious an illness?
Yeah, look, I don't know that I'd characterise it as apathy. I think, part of the messaging about Omicron has been overly simplified. There is a nuance here. It is less severe than Delta, that's for sure. But it is not a mild virus. We've got record numbers of deaths in New South Wales. We've got deaths in Victoria that are reaching the kind of levels that we had when we had an entirely unvaccinated population. And so at a population level, it remains a dangerous virus. For the individual, for the one person who's received 2 doses of vaccine, it's not going to be as severe an illness. There's no question about that. But it's still killing people, and it's still putting people in hospital, including those who've had 2 doses. So you're right, there might be less concern as there has been previously, and certainly we've gone through a couple of years where we had a really heightened level of sensitivity about this virus. That will change, and it's appropriate for it to change. We're taking the bite out of this virus by virtue of the very high vaccination coverage we're getting, but we can and should do more because there are people who have significant underlying conditions, there are people who remain vulnerable and who'll end up in hospital. So I can't emphasise enough, get that third dose.
Do you think that makes it sort of more challenging in the sense of the state, because the risk assessment by individuals has changed? We're not as risk averse perhaps about this strain, yet the risks for the state are just as big or bigger than they were previously.
Yeah, I think that's a difficult issue to get across. People will make their own individual risk assessments, that's true. I want them to try and see things through the lens of a healthcare worker, because healthcare workers are telling you that they've had 3 tough years. They're continuing to work as hard as they ever had, and they're continuing to see people who shouldn't be in hospital, people who could have gotten their third dose, or people who are unvaccinated and haven't got their first dose. So if you can try and see it through the eyes of a healthcare worker, and it's not just about the burden for the state, it is about the fact that these are real families, these are real people who are losing their lives, who are being left with significant ongoing medical issues because of severe illness.
Brett, just going back to your advice on
Is it a relief to see the case numbers tracking downwards in
Yeah.
recent days, and how do we think that's going to go?
Yeah, I think so. As I've said earlier, there is some uncertainty. We don't know about some cases that might be out there that haven't gotten tested, maybe people with no symptoms whatsoever who simply aren't getting a prompt to test. We know that the turnaround time for our PCR testing is much better now, really back to normal, but we can get more RAT tests out there and we need to. So there might be some people who aren't getting tested because they're not getting access to tests, but the wait times have come right down, half an hour in most test sites routinely. So I hope that what we're seeing as our peak of numbers is real. I think it is, and we're on the downslope. That said, ICU hospitalisation is probably more getting to peak rather than being on the other side.
Has the state government done any sort of modelling or studies on what you think the true rate of infection is in the community? Just to follow up on that.
It's very hard to do. I think we're looking to overseas examples about where things turn around and what kind of assumptions there are there. It may be that there are lots of asymptomatic people who are contributing to natural herd immunity, but we can't know for sure. There might be other factors at play, and unless you do a very large kind of serological survey, blood tests in hundreds of people or thousands, then you can't know for sure.
I just want to go back to your answer to Chanel's question, just follow up what you're saying about the advice for when to get a booster dose if you've had COVID. So you're saying ATAGI's obviously working on its own advice. From your understanding as a clinician, do you think there is any disadvantage to getting it immediately after recovery?
There's very little disadvantage. I think, we're going through a phase of the pandemic where it's everywhere. Omicron is literally everywhere. And so you will have some natural protection from being recently infected. It's likely to last for a month. We don't know how much longer beyond that it lasts. So if you're recovered, getting it at that 1 month mark, I think is okay. ATAGI may well look at the evidence and say, you're probably protected for a couple of months from natural infection, but then it's appropriate to get a real prime to your immune system with that third dose, because Omicron reinfections have occurred and it's not going to provide long-term immunity. That's also pretty clear from the science.
So that applies to both an Omicron and a Delta infection?
Yeah, look, the fact that Omicron has infected people who've been previously infected with Delta means that it can get around that natural immunity. The other thing to note is we're at 100% or very close to 100% of Omicron in the community now. It's probably more like 50-50 in ICU or in hospitalised patients, but for the community cases, overwhelmingly Omicron.
And you said Omicron reinfections can occur. Is that, when you say that, do you mean someone with Omicron can get Omicron again, or is that Delta then Omicron?
Well, essentially I'm saying that people who've had infection with Omicron and just have the natural immunity, that's not going to be long lasting. So whatever other variant comes, including being re-exposed to Omicron, is a risk.
And just on the numbers, maybe past the peak, but in 2 weeks' time, we'll probably see a lot more people go back to offices. They've become back that month, and school will go back. All the numbers tend to go up again.
I think there'll be a challenge with schools to some degree. Clearly, there'll be some kids who are cases who'll turn up for school. That's why all of those mitigations are really important, and kids need to do that twice weekly rapid antigen testing to make sure that they're not taking it into schools. But it's a new movement of kids. They're going to be interacting with more children than they have through this holiday period. It applies in workplaces as well. But we have to assess that work from home recommendation really on a week by week basis, and we'll do it as schools come back and looking at the numbers then.
Can I ask the Treasurer, just many businesses...
Earlier elective surgery issue that surgeons have been raising with us, is there any flexibility or room to move from the current plan to allow potentially day procedures that might not tie up beds for a prolonged period? Is there any working on that or thinking about that?
Yeah, it's not a matter for me. I think from a public health transmission of illness perspective, I'm comfortable with an assessment of the ability of some areas of surgery to come back online, but it's for the State Controller Health, the Secretary of the Department, on advice from the clinical team to really go by a case-by-case assessment. I think there is an opportunity to review on a case-by-case basis, and I'll provide advice to him on that.
But on that, I think the Active Health Minister's announcement the other day, they were able to resume IVF based on your advice.
No, it wasn't specifically my advice to resume IVF. It was that I really had no concerns about the resumption of IVF from a public health perspective. But it was in addition, it was the State Controller for Health who advises on elective surgery matters.
So can you advise, if they consulted you on what could resume?
So again,
There's so many people out there that want,
yeah, indeed. And look,
cancer, chemotherapy.
it's an issue of beds, it's an issue of workforce, it's an issue of theatre availability. They're not issues that I oversee. I will look at whether there are public health implications for the resumption of any of those and advise in that regard, but the clinical team will advise the State Controller on those matters.
Because, sorry Brett, just to be really clear on this, the media release which announced that IVF was back, the first lines were following advice from the Chief Health Officer, IVF can resume. So you're just to be clear, you're saying that's not just your call.
It's not just my call. Of course I provided advice.
It's not just a clinical call, is that right?
That's correct.
Okay.
And just to be clear, thanks, Brett. This is about the effective.
I won't say the tennis player's name because I won't be able to do it any justice, but one tennis player said they turned up with COVID, they went into quarantine and then came out. When you're looking forward to events such as Grand Prix, such a large amount of people coming from Europe, would they have to quarantine for longer than the 7 days? Are you looking at different options of quarantine than emerging variants and things like that?
So quarantine specifically, these are people who are not cases but who are arriving internationally, will be subject to the same quarantine requirements as everyone else. That's testing within the first 24 hours. So there won't be a longer period of quarantine, except potentially for fully unvaccinated individuals who might be allowed in the country. At the moment, I can't see that that's an allowance from what I understand.
You turn up, I mean, you're fully vaccinated and then you turn up and you test positive.
Yeah.
Will it just be 7 days like everyone else?
Yes, it will. It'll be applied equally, and who knows what the world will look like in Feb or March, but that's my expectation for isolation.
Do you think there's a case to allow unvaccinated people to arrive internationally in quarantine for 7 days instead of 14?
I think it's worth looking at, but we need to assess the proportionality of that against everyone else who's arriving into Victoria or who's otherwise got quarantine arrangements. But I think it's something worth review.
So if that was in place, potentially Novak Djokovic could have locked up and just spent the week in the hotel.
Well,
Detention centre and got in playing tennis.
yeah, I guess the key question is can you get a visa to enter the country? That was the obstacle for Mr. Djokovic.
Do you think Western Australia is doing the right thing by keeping their borders shut?
Oh, entirely a matter for Western Australia. I think good on them for being in a position where they can make assessments from virtually no COVID transmission around the safety and health of their population, but entirely a matter for the Premier. Thanks.
Thanks, guys.
So for anyone who wants